It's wonderful to be with you. I don't know actually what could be nicer than to be here in Southwest Florida this time of the year. And for me, it's not just being in Southwest Florida, it's being away from where I've spent most of my adult life, and that is in the East Coast corridor between New York and Washington, D.C. For one thing, it's so much friendlier down here in Florida. Last time I was up in New York, I was downtown on Wall Street. I had to get up to Grand Central Station. I don't know if you know the subway system, but it's a little bit complicated. They have local trains and express trains, and if you don't know the difference, it's a little bit troublesome trying to figure out where you're going. So I was down on the subway platform in Wall Street, and I saw a guy standing on the platform who looked to me to be a friendly native New Yorker. So I said to him, does it matter which one of these trains I get to take to get up to Grand Central? And he said, not to me, it doesn't, buddy. That's New York City for you. So today we're going to talk about the Constitution and healthcare. Some of you may recall we spent a lot of time helping to draft a constitution for Iraq. One guy during that process commented, why don't we just give them ours? It was written by some really smart guys. It's worked for more than 200 years, and we're not using it anymore. And sad to say, there is something to that, and that is a good backdrop for our discussion of the ObamaCare decision. On the final day of the Supreme Court's 2012 term, Chief Justice John Roberts issued this blockbuster opinion on the constitutionality of ObamaCare, which is more formally known as the Affordable Care Act, ACA. And in a single opinion, Chief Justice Roberts gave us practically a complete course in constitutional law. To a large extent, those of us who are concerned with ever-expanding government can trace that concern to the Supreme Court's treatments of a couple of clauses in the Constitution, specifically the Commerce Clause, the taxing power, the spending power, and the necessary and proper clause. And interestingly, all four of those were involved in the Obamacare decision. The case was National Federation of Independent Businesses versus Kathleen Sebelius, who is the Secretary of Health and Human Services. It was filed by the state of Florida. They were the lead plaintiffs in the case. And 25 other states, as well as several individual plaintiffs and the National Federation of Independent Businesses. And they raised three key issues. The first issue is the mandate that requires individuals to buy health insurance or pay a penalty. Is this constitutionally authorized under the Commerce Clause? The second question, is that same mandate, if it's not authorized under the Commerce Clause, authorized under the taxing power? And the third question, unrelated to the first two, can the federal government order the states to expand their Medicaid programs? Or if not order, can they threaten the states with loss of benefits that are so large that it amounts to an order? So we're going to take a look at those issues one at a time without getting too much into the legalese. How many of you are attorneys? Good, just great. So it's like I don't have to dumb down the talk like I do for attorneys. So I'll try to avoid the legalese. So we'll look at the issues one at a time, and then I'll summarize what the Supreme Court's concluded. But to begin, let me raise this question. Why was it necessary for Obamacare, for the administration, to compel individuals to buy health insurance? And the reason is that without health insurance, and the president conceded this, the rest of the legislation falls apart. And that's because Obamacare requires insurance companies to cover pre-existing conditions. Now, this is a real problem. People get sick. Most people in this country have their insurance through their employer. So what happens if they get sick, they have their insurance through their employer, and then they lose their job? Either they quit, or they get fired, or for some other reason they're out of work. And now they got to go to another insurance company and try to get insured, and they're already sick. And of course, if you have a pre-existing condition, you're not likely to be covered by an insurance company. Insurance companies are not stupid. They don't insure houses against fire if the fire is already smoldering. So the insurance companies quite sensibly said, we cannot do this without losing a lot of money. The insurance company argument was our consumers are not ignorant. If we have to cover pre-existing conditions, and particularly, and this was also a provision in the law, if we can't charge more for somebody who's sick than for somebody who's healthy, even though they have a pre-existing condition, then what will our consumers do? They will simply wait until they're sick before they take out insurance. Why would anybody take out insurance when they're healthy and pay the premiums if they know that when they get sick, they can get covered and at no increase in premium? Now, the problem is that if healthy people don't take out insurance, then the insurance companies can't get premiums, and they use those premiums to pay benefits to unhealthy people. So that's an unintended consequence of requiring insurance companies to cover pre-existing conditions. How's that going to be fixed? The Obama administration had this answer. We are going to force people not to wait and to take out health insurance, whether they're sick or not. And if they don't take out health insurance, we are going to charge them a penalty. So that's why the mandate was required. It's really a subsidy to the insurance industry so the insurance industry can afford to cover pre-existing conditions. And this kind of federal mandate to buy a private product was unprecedented and untested by the courts. The last time it was tried was way back in 1994. Some of you may remember HillaryCare. And the CBO, the Congressional Budget Office, wrote this, and this is a quote: "The government has never required people to buy any good or service as a condition of lawful residence in the United States, yet that is precisely what Obamacare purports to do." But, said the opponents of Obamacare, where in the Constitution does it say that Congress can do that, can require you to buy insurance or be hit with a penalty? And according to the administration, the answer is the Commerce Clause. The Commerce Clause. And so to better understand the Commerce Clause power, and here's where we start a little lesson in constitutional law for those of you who have not studied the Constitution. First, we have to define a couple of terms. The first term is commerce. What do we mean by commerce? Commerce is simply the exchange of goods. It means buying and selling. The second term that it's necessary to define is an economic act. An economic act is broader than commerce. It's broader than just buying and selling. It includes all of those things involving goods and services that can affect the amount of goods bought and sold. And that would include, for example, farming or manufacturing or mining or distributing, certainly buying and selling, and then also consuming. All of those things are economic acts that go beyond mere commerce, which is buying and selling. So those are the two key terms. And if you think it's self-evident that the commerce power, and that is the clause in the Constitution that says Congress is authorized to regulate commerce among the states, if you think that the commerce power is restricted to things that involve commerce and things that are among the states, then you have not been following the Supreme Court for the last 7 decades. The key case was a 1942 case called Wickard v. Filburn, and it laid the groundwork to expand the Commerce Clause beyond regulating just commerce to regulating all of these other economic acts that have an effect on commerce. And this is the way that case unfolded. Mr. Filburn grew wheat primarily on his own farm. He didn't buy the wheat, he grew it. And he didn't sell the wheat. He ate it, or he gave it to his farm animals. The Roosevelt administration during the Depression came in and said, "Mr. Filburn, the price of agricultural products is declining, and we need to make sure that the price goes up a little bit. And Econ 101 tells us if we want to raise the price, we got to cut back on the supply. And so you, Mr. Filburn, along with a lot of other people, are going to have to stop producing so much." And Filburn said, "Under what authority are you telling me that I can't produce?" And the Roosevelt administration said, "The Commerce Clause, we are regulating interstate commerce." Filburn predictably replies, "Well, guess what? It's not interstate, it's all on my farm, which is within one state, and there's no commerce involved. I'm not buying it, I'm not selling it, I'm growing it, and then I'm either eating it or giving to my farm animals." The Supreme Court took a look at this case and essentially said, "Filburn, you just don't get it. If you weren't out there growing this stuff, you would have had to buy it. And if you weren't eating everything that you grew, you would have had some left over to sell. So, by growing and eating, instead of buying and selling, you obviously had an impact on the supply and demand for wheat. And when we consider this in the aggregate, all the other folks that are probably doing something similar to what you're doing, this would have a substantial effect on interstate commerce. And that opened up the floodgates through which the regulatory state was ready to pour, regulating anything and everything under the auspices of the Commerce Clause. 43 years later, in 1995, the court was asked to approve another, even larger expansion of the Commerce Clause. And the question in this case was whether or not the Commerce Clause could conceivably cover a non-economic act. We already know it covered commerce. We already know that it covered economic acts that have an effect on commerce, but could the Commerce Clause cover a non-economic act? And that is an act that doesn't involve growing, mining, manufacturing, distributing, buying, selling, or consuming. The case involved was called United States versus Lopez, and it involved the possession of a gun within 1,000 feet of a school. The federal law said you couldn't have a gun within 1,000 feet of a school or you'd be committing a criminal act and you could be prosecuted by the federal government. And the Supreme Court finally drew a line in the sand and said, nope, enough is enough. It's one thing to say you can regulate commerce, buying and selling. It's another thing you can regulate economic acts that have an effect on commerce, but the mere possession of a gun, just having a gun. And by the way, there were state laws on the books in every single state that regulated the possession of a gun near schools. Merely the possession of a gun is not an economic act. And so, said the Supreme Court, you may not regulate non-economic acts under the Commerce Clause. Then came Obamacare, and we even went one step further. The individual mandate that says you have to buy insurance or pay a penalty in Obamacare, it goes beyond commerce. It goes beyond the economic acts. It goes to things that are not acts at all. That is to say, it compels the purchase of a product, namely health insurance, that first of all is illegal to purchase across state lines. As you may know, you may not purchase health insurance across state lines. And secondly, there is no act involved. It is the concerted decision to avoid engaging in an act. It's a non-act. So essentially, the insurance mandate is what's called regulatory bootstrapping of the worst sort. Congress first forces you to engage in an act, and then Congress proclaims that you can be regulated under the Commerce Clause because you are engaged in an act. If Congress can do that, Congress can do pretty much whatever it wishes. But in my view, and now affirmed by the Supreme Court, even if Congress can regulate Mr. Filburn's wheat production, that doesn't mean that Congress can force me to go to the grocery store and buy bread so that I subsidize wheat growers. And in the same sense, Congress cannot require you to purchase health coverage so that you can subsidize insurance companies who in turn can afford to cover pre-existing conditions. The litmus test is economic activity. A mental decision not to buy insurance is not an economic act. In that respect, it's no different than a decision not to work. Neither decision can be regulated simply because the non-act, if it were converted into an act, would have a substantial effect on interstate commerce. The subject matter has to be economic in nature. It must affect interstate commerce, and it must involve activity. Thought processes are not, at least yet, subject to regulation. So if a decision to buy, not to buy health insurance is an economic act, if that were the case, then so are other so-called non-acts that the government could regulate. Can the government, for example, force me to join a gym rather than exercise on my own? Can the government force me to join Weight Watchers rather than diet on my own? Plainly, that cannot be the state of our law. Now, the folks who are in favor of this mandate argue that, health care is unique because everyone is a consumer of health care at some point or another. Now, in point of fact, that's not even correct. The first thing to note is that Obamacare's mandate requires coverage for such things as pediatric care, maternity care, and substance abuse. Most Americans are not consumers of those services at any time. Second, there are other things that everyone consumes, things like food, clothing, and shelter. can the government mandate how and when and where those products are to be purchased? Never has the Commerce Clause been stretched to such lengths, and that's why the proponents of Obamacare needed to have a fallback argument. And the fallback argument was another clause in the Constitution. It's called the Necessary and Proper Clause. So suppose the mandate to buy health insurance doesn't qualify. As the Supreme Court ruled, it does not qualify as a regulation of interstate commerce. Even so, said the administration, the Constitution authorizes implicit powers which provide, and this is the Necessary and Proper Clause, that Congress can make, this is a quote, all laws which shall be necessary and proper for carrying into execution its other laws. So if Congress wanted to regulate the interstate health care system, which clearly is interstate commerce, and if it was necessary and proper to do so, to mandate that you buy insurance, then that would be permissible. So if the government could show that the insurance mandate was both necessary and proper to regulate interstate commerce, the courts would be unlikely to intervene. That assertion, however, is also incorrect. It's based on two underlying arguments, both of which are fallacious. First, the mandate to buy health insurance is said to be necessary because its elimination would perpetuate this problem that we all know about, the problem of the uninsured. That is to say, without a mandate, without requiring everybody to be insured, responsible insured consumers have to pay the health care costs of irresponsible uninsured consumers, or maybe not even irresponsible, just persons who do not have sufficient resources. But this cost shifting of uninsured people to insured people is not inevitable. Why does it happen? It happens because by law we have compelled hospitals to serve all comers. Now maybe that's a good idea, but if it's a good idea, we ought to have a straightforward and transparent tax to pay those bills, not a hidden cost imposed on insurance companies who then pass it along to us by making us buy health insurance policies that we do not want. And bear this in mind as well. Cost shifting occurs only under this set of pretty rare circumstances. A person gets sick. He seeks medical care. He doesn't have the resources to pay. He has no access to funds from his family, from his friends, from private charities. And that situation, if and when it arises, can be more efficiently addressed, for example, by mandating community service by emergency patients who show up for service and do not pay their bills. We impose that punishment, namely community service, on lots and lots of minor crimes. And even if almost everybody ultimately consumes health care, not everyone gets health care free at public expense. And paradoxically, who does? For the most part, it's low-income individuals who either are irresponsible or simply do not have the resources through no fault of their own, and they are the ones most likely to shift their costs to taxpayers. And what about these low-income individuals? Are they treated by Obamacare? They are not. Either they're covered by Medicaid, or if they're not covered by Medicaid, they are exempt from the Obamacare penalty. So the very persons who are most likely to impose costs on the taxpayers are actually exempt from the penalty imposed under Obamacare. Illegal aliens are also exempt. Other non-residents are also exempt, and they do burden the taxpayer if they show up for emergency services and are not able to pay. In reality, the most persons who are regulated by this mandate are not sick freeloaders, but healthy individuals who forego insurance because they prefer to forego insurance and they pay their own bills. And we need to put this problem into perspective. The total cost of uncompensated emergency care annually is about $48 billion. That sounds like a big number, and I don't mean to trivialize it, but $48 billion is only about 2% of our annual health care expenditures, which are $2.4 trillion. So it's a meaningful problem, but it's scarcely what we would call a crisis. There's another argument, and that is an insurance mandate eliminates this cost of uncompensated care. It does not. It simply transfers the cost to insurance companies. And the insurance companies then have to recoup their outlays by selling mandated policies to individuals who prefer not to buy those policies. And in fact, total health care costs are going to increase as more people become insured. And that's called the moral hazard predicament that everybody who's in the insurance business knows about. Insured people will demand more services than people who are not insured, because those who are not insured are paying for those services out of their own wallets. It's no accident that the costs of cosmetic surgery and LASIK surgery have come plummeting downward. They are not covered by insurance, while the cost of MRIs has exploded because it is covered by insurance. So Obama's insurance mandate, regrettably, is going to make matters worse. It is not only unnecessary, but it actually exacerbates the problem. Now, that's not to say that some non-purchasers of health insurance do end up imposing costs on others, but so do non-purchasers of lots of other products. For example, if I refuse to purchase nutritional foods, and if I were covered by Medicaid or any other public health policy, that would impose costs on the taxpayers in general. If I refuse to purchase exercise gear, if I refuse to engage in preventive medicine, all of those things would impose costs. Does the government claim authority under the necessary and proper clause to coerce the purchase of those products? And if so, why stop with health care? We have defaults on credit cards and mortgages. When that happens, it raises interest rates for everybody. So does the government claim authority to compel everybody to have credit card insurance or mortgage insurance? Now, the administration has yet another rationale for claiming authority under the necessary and proper clause, and it's a rationale that we've already discussed. Namely, everybody should be covered for pre-existing conditions, and the mandate is necessary, is essential to accomplishing that goal. The case here in Florida was litigated, and the judge's name was Vincent, and he saw through that argument. He said the mandate is only artificially necessary. It's required only because Congress itself created the problem and left no alternatives. Here's what Vincent wrote. The individual mandate is actually being used as the means to avoid the adverse consequences of the act itself. And by that consequence, he was talking about the required coverage of pre-existing conditions. Under such a rationale, said Judge Vincent, the more harm the statute does, the more power Congress can assume for itself under the necessary and proper clause. So imagine that Obama goes to the food industry and he says, you know, obesity is a huge problem, and to control costs, we're going to have to ask you folks to quit producing chocolate. And the food industry says, well, you know, we make a lot of money on the sale of chocolate, so how are we supposed to avoid that kind of economic hit? And the administration says, don't worry about it. Whatever you're going to lose on sale of chocolate, just jack up the price of celery. And of course, the food industry would respond, I think quite understandably, we're not selling all that much celery right now. And if we jack up the price of celery, the chances are very good that we're going to sell less than we sold before. And the administration's response would be, don't worry about people not buying as much celery. We're going to force them to buy as much celery, and if they don't buy as much celery, we're going to hit them with a penalty. Now, this is exactly the analogous situation as exists with the insurance mandate. So would this mandate to buy celery or pay a penalty be a necessary and proper regulation of interstate health care? My answer, not constitutional. 5 Supreme Court justices agree with that. The individual mandate would have extended the dominion of the Commerce Clause coupled with the necessary and proper clause to virtually all manner of human conduct, including non-conduct. And Congress's attempt to punish inactivity is an intolerable affront to the Constitution and to liberty and to personal autonomy. And that cannot be altered by calling it health care reform. Now, the federal government did have one remaining line of argument, and it's the argument that ultimately won for the federal government, and that is that the mandate, even if it's not authorized under the Commerce Clause, is authorized under the power of Congress to lay and collect taxes to provide for the general welfare. So this is known variously as the General Welfare Clause, or sometimes it's known as the taxing power. And it all can be traced to another case, this one coming from 1937, a case involving Helvering v. Davis, which a lot of people in this room should care about because the issue in Helvering v. Davis was whether or not the Social Security system was constitutional. Now, in examining that issue, you have to think like a judge. It's not whether the Social Security system is a good idea. It's not whether the Social Security system is actuarially sound. It's not whether some of us in this room enjoy getting our monthly check from the Social Security system. The issue for a judge is, where in the Constitution can you find authority for the federal government to tell us not only that we must provide for our own retirement, but how we must provide for our own retirement? And if you ask the proponents of the Social Security system back in 1937, they pointed to the power to tax in order to provide for the general welfare. We impose a Social Security tax, and it redounds to the benefit of everybody. This, back in the framing era, was a big battle between Madison and Hamilton. Alexander Hamilton said, the power to tax in order to provide for the general welfare is an extra added power of Congress over and above all the other powers of Congress that are listed, like declare war, coin money, regulate interstate commerce, and the like. In addition to that, said Hamilton, the government has the power to tax in order to provide for the general welfare. Madison said that can't be the case, because if government can tax in order to provide for the general welfare, just about everything can be characterized as providing for the general welfare, and then we would have a federal government of unbounded powers, when we know what we intended to create was a federal government of limited powers. And Madison even went a step further. He said, not only isn't the General Welfare Clause an extra added power of Congress, it's actually an impediment to Congress's exercise of its existing powers. Here are all these powers that are listed in the Constitution. Those are the ones that Congress can exercise. And the General Welfare Clause adds another hoop that Congress has to jump through. In exercising only its limited list of powers, Congress must exercise those powers and those powers only in a manner that promotes the general welfare and not the welfare of what Madison called factions and what we today call the special interests. Again, the Supreme Court looked at this, and basically Hamilton wins and Madison loses. That opened up a second set of floodgates through which the redistributive state was ready to pour, taking money from some people, giving it to others without any constitutional constraints. And of course, this became the basis on which the Obama administration claimed that the mandate to purchase health insurance or pay a penalty was an exercise of Congress's power to tax in order to provide for the general welfare. Now, only one of the 8 courts that looked at this argument embraced this taxing power logic. 7 other courts out of 8 rejected the logic. And even the Obama administration didn't think very much of its own argument. They spent almost no time at oral argument before the Supreme Court discussing the taxing power, and it only took up a paragraph or two in their legal briefs. And there were lots of reasons for the courts and the administration to be skeptical of the taxing power. First, the purpose of a tax is to generate revenue. What about the penalty under Obamacare? If it worked perfectly, it would generate zero, no revenue whatsoever. Its purpose was to force you to buy a health insurance policy. If the administration had its way, nobody would pay that penalty. So quite clearly, its purpose was not to generate revenue. Second, only legal acts can be taxed. So we can tax cigarettes, for example, because they are legal. We cannot tax heroin. Heroin is illegal. And under the bill, so would be the refusal to buy a health insurance policy. When something is illegal, we do not tax it, we penalize it. Third, Congress had written tax in its draft of the legislation, and then it stripped out the word tax and inserted the word penalty. And Congress used the word tax elsewhere within the Obamacare legislation. So quite clearly, Congress knew how to say tax when it meant tax and how to say penalty when it meant penalty. And finally, there is a section in the legislation that says what is the constitutional source for this legislation. And if you look in that section, it says quite clearly the Commerce Clause. There is no mention whatsoever of the taxing power. Congress and the President did not want the scrutiny that attaches to a large increase in taxes, especially if the President had repeatedly called the assessment a penalty and reminded voters that he would not be imposing any new taxes on the middle class. Well, with a wave of the Roberts wand, an unconstitutional penalty has somehow morphed into a constitutional tax. And it was on that basis that the administration's bill, the Obamacare legislation, was determined to be constitutional. Now, there is one remaining issue unrelated to the insurance mandate, and that is the expansion of Medicaid. Just how hard can the feds push to persuade the states to expand Medicaid? Now, the way Medicaid works roughly, I'm skipping all the details, is like this. The federal government pays anywhere from 50 to 80% of the cost of Medicaid, and the states pay the rest. Generally, the richer states pay more and the poorer states pay less. The feds pick up the balance. There are roughly 60 million people covered. That's 60 million people covered by Medicaid. Under Obamacare, the states would expand that coverage by 15 million more people. That's 25% more people, and would cover everybody that's making up to 133% of the poverty level. Now, if the states agreed to expand Medicaid, then the feds would cover just about all the cost for about 4 or 5 years, and then after that, the feds would cover 90% of the cost. But if the states disagreed and would not expand Medicaid, then the federal government would withdraw all Medicaid funding. That's anywhere from 50 to 80% of the total cost of the state Medicaid program. And this is called conditional spending. This is the way Congress gets around the fact that it's restricted to certain enumerated powers in the Constitution. Congress tries to do things that it's not permitted to do, and then claims it's not really doing them because it's giving the states an option. It's not compelling them, it's giving an option. And if you want a good example of that, the key case was back in 1987 called South Dakota versus Dole. Congress wanted all the states to adopt a 21-year-old drinking age. Now, of course, Congress doesn't have the authority to tell the states what the drinking age ought to be in an individual state. So this is what Congress said. You don't have to do this, Mr. State. You can do it or not do it. But by the way, if you don't do it, we're going to withhold some of your federal highway funds. Now, the court said you can only do that if there's a pretty good tie between the purpose of the statute and the condition that you're imposing. So ask yourself, what is the tie between withholding federal highway funds and the drinking age? And the court came up with this convoluted logic. If you don't have a uniform drinking age, if some states are lower than others, then young folks are going to go into the state where they can drink, they're going to get drunk, they're going to drive back to their home state drunk, they're going to have accidents, and Congress wants the highways to be safe, and therefore Congress has a justification in imposing a uniform drinking age so that the highways can be safe, and Congress's expenditure of highway funds is for a useful purpose. And of course, if that's the extent of the link that's required, nothing will be overturned under the spending power. And in fact, nothing ever has been overturned under the spending power until the Obamacare legislation. The Obamacare legislation became the first to overturn a spending by Congress under the spending power. The spending power is a powerful tool for Congress to get the states to go along with federal programs. Less true today. For the very first time, Roberts and 6 other justices declared that the condition imposed on spending is unconstitutional. Why? Because the threat to withdraw 100% of Medicaid funds is coercive. It really doesn't give the states an option. It's one thing to say to the states, we're going to take away 5% of your highway funds. That's what it was in South Dakota v. Dole back in 1987 when the states wanted a uniform drinking age, 5% of the highway funds. That's not coercive. But if they say they're going to withhold all of the Medicaid funding, that indeed would be coercive. So thanks to Chief Justice Roberts, the spending power now has limits. Let's recap the court's various holdings. First, the court's more conservative justices agreed with Roberts that the insurance mandate is not within the commerce power. The Congress cannot force people to engage in commerce in order then to regulate them because they're engaged in commerce. Second, the same 5 justices held that the mandate is not covered by the necessary and proper clause. Congress cannot create a problem by passing a statute like Obamacare and then claim constitutional authority for a specific provision like the insurance mandate because it's necessary to fix the problem that Congress created in the first place. But the government ultimately got what it wanted. Roberts, joined by the 4 liberal justices, held that the mandate is authorized under the taxing power, even though Congress and the President had called the fee for not buying insurance a penalty. And finally, Roberts and 6 justices, all except for Ginsburg and Sotomayor, held that federally directed Medicaid expansion is unconstitutional if the states that refuse are threatened with the loss of all of their Medicaid funding. That would be coercive. From a constitutional perspective, and you can see how this is really a class in constitutional law all within one ingenious opinion. From a constitutional perspective, I'd call the decision a mixed bag. If the limits are going to be stretched for the powers of government, I'd really rather have them stretched under the taxing power than under the Commerce Clause. First, taxes, as you know, are politically toxic, and that limits their use. And second, the taxing power imposes monetary burdens if you do something wrong, namely pay the tax. The Commerce Clause, if you do something wrong, for example, if you smoke marijuana and it's illegal to do so, and the federal government regulates you under the Commerce Clause, your penalty, of course, can be incarceration. The Roberts opinion came as a complete surprise to everybody. From the beginning, there were 2 primary questions to be answered in this case: whether Obamacare would survive, and whether there were any remaining limits left to the exercise of federal power. So legal scholars across the board, across the ideological spectrum, they expected one of 2 outcomes. Nobody expected the outcome we got. One outcome they expected would be either Obamacare would be upheld, and that would be a harbinger of really unbounded federal power, or Obamacare would be invalidated because the court had finally reined in federal authority. What did we get? What nobody anticipated. He saved Obamacare, Chief Justice Roberts, while at the same time he did establish some significant limits on the exercise of federal power under the Commerce Clause, the Necessary and Proper Clause, and the spending power. So the opinion is a masterpiece of political compromise. It gives something to everyone. It suggests that what Chief Justice Roberts was interested in is consensus building, ensuring that the court is not perceived as ideologically divided and as overtly political. Those motives are not inherently bad, unless, as in this case, they lead to a legal analysis that condone what I still believe to be an unconstitutional law. In the challenge to Obamacare, our fundamental first principles are at stake. So we limit government power so people can live their lives the way they wish. This is not just an academic exercise to map out the precise contours of the Commerce Clause and the taxing power. That's a worthy endeavor, but that is simply a means to achieve the goal of maximizing human freedom. And that's why Americans allow government to exist. And that's why the Roberts Obamacare opinion, skillful though it was, ultimately failed. Once again, the Supreme Court found a way to expand the reach of the federal government at the expense of individual liberty. Thanks very much.
Thank you very much, Bob. We've got a few questions, and if there are any more, we have people, Candace and Andrew, are circulating, I think, or you can get them over to Carmen here if you have any more questions. And this first one's pretty clear, Bob. Can we get rid of Obamacare?
Probably not. There are lots of cases pending in the courts. Of course, one way to get rid of Obamacare, of course, is through the legislature. But frankly, you'd have to get past a presidential veto if you had a bill to repeal Obamacare, and you'd also need 60 votes in the Senate. And if you're not going to get 60 votes in the Senate, and even if you got 60 votes in the Senate, you would not get, is this working? You would not get pass the presidential veto. So the other way of getting rid of Obamacare is through the court system. And let me tell you about a bunch of litigation that's pending. The first is a challenge to what's called the Independent Payment Advisory Board, which sort of pejoratively has been called the death panel. I think that's an absurd name for it, but basically what it is, it's a board that's set up by Obamacare that allows this board to say what the reimbursement rate is going to be for doctors in certain particular operations. Now, of course, if you set the reimbursement rate low enough, basically you ruled out those operations. So there is a sense in which this board could result in the rationing of Medicare, of Obamacare. But more likely than not, Congress would find a way around that if indeed the board rationed a product. Maybe I should use one of the other mics, can I? Yeah.
I think, try it now. Try it now, Bob.
Test, 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 test.
Is that better?
Is this better? Well, I'll try it for a couple seconds. So one challenge is for a challenge to these independent payment advisory boards. The second is that Liberty University has filed a challenge to the requirement that they cover contraception. This is a First Amendment challenge. It comes under the area of religious freedom. It has a better chance of success, but it only addresses a very small portion of the Obamacare litigation. A third is that the Pacific Legal Foundation has filed a challenge under what's called the House Origination Clause. And this is kind of interesting. Whenever you have a tax, and of course that's what the Supreme Court said this is, it's a tax, not a penalty. Whenever you have a tax, the bill has to originate in the House of Representatives. Well, how does the Congress get around that? They get around it by a sham piece of legislation. They take a bill that originated in the House of Representatives, and then they amend the bill. And the way they amend it is they strip it of all its contents, and they strip it of its title, and they replace the title with Obamacare, the Affordable Care Act, and they replace the contents with the several thousand pages of Obamacare, and they claim that this is not a new bill. This is, in fact, an amendment to an existing bill. So this is quite clearly a sham, and the reason the courts might not buy the argument that it's a sham is because they have allowed this to happen for decades, and it's been done by both parties, Republicans and Democrats. But there is that challenge pending. Then, in addition, there is a challenge that was initiated by one of my colleagues at the Cato Institute, and it arises from a very complicated provision in the healthcare law, which says that the states can establish exchanges, but if the states decide not to establish exchanges, the federal government can come in and establish exchanges where insurance is available. But the law says, if you read it very carefully, that if the feds establish the exchange, no subsidies are available to purchase of insurance. So that's being challenged. If no subsidies are going to be available, this thing will die of its own weight. So there are 4 or 5 legal challenges pending. I would say all of them are uphill battles, but it's possible, although not likely, that Obamacare could be effectively eliminated by the judicial process, very unlikely by the legislative process.
Secondly, how much difference does the Constitution actually make today? That is, how much does the Constitution really matter in the actual practice of the country today?
Can we switch? Switch? This is all right? Okay. Is it still in and out?
Interference, yeah.
Switch? Okay. All right.
I think the two of them can't be on at once.
Yeah. You know, we're asked at the Cato Institute, what changes would we make to the Constitution if we had to make some changes and we had the ability to rewrite it? And our stock answer is that we would just add 5 words at the end. That's it. And the words would be, and we really mean it. So that, you know, it's not the problem of the Constitution. That's not the problem at all. The Constitution is a magnificent document. It's not a perfect document, but it's pretty darn close. The problem has been the interpretation of the Constitution by the judicial branch primarily, but also by the legislature and the executive branch who they take their liberties with the Constitution, liberties in the worst sense of the word. So I don't believe the problem is the text of the Constitution. It is true that the courts have played so loose with that text of the Constitution that we have not been able to apply its provisions in a manner that has succeeded in expanding individual liberty and strictly limiting the powers of government. But there is always hope, and I think we have made some inroads. We've made some inroads with respect to the Second Amendment. We've made some inroads with respect, I think we're going to make inroads this term with respect to affirmative action. We've had inroads at the state level with respect to the use of eminent domain for economic development purposes. So there are some areas where the court has acted to rein in government power. And in fact, the Obamacare decision is one of those areas. Even though it affirmed the legislation under the taxing power, it established some very important limits that will be critically important going forward under the Commerce Clause, Necessary and Proper Clause, and the spending power. I'm good.
Thank you. Next question. Once Judge Roberts ruled it was a tax, and within Congress's authority, should it have been set aside until a tax penalty was assessed?
Well, that's a great question. There is what's called the Anti-Injunction Act. The Anti-Injunction Act says that the only way you can challenge a tax is to pay it. Sue for a refund, get refused, and then you can go to court. You may not go to court before you actually pay the tax. And this is called ripeness. That is to say, the lawsuit would be premature. The cause of action would not be ripe because you haven't yet been injured, because you haven't yet paid the tax. Now, as you know, the penalty for not buying health insurance doesn't go into effect until 2014. So, should not this case, since Chief Justice Roberts found out it was a tax, should not this case have been sent back and say, we're not going to deal with it until 2014? And the answer is, of course, that Chief Justice Roberts knew that full well. And so what did he do? He said, well, you know, for purposes of the Anti-Injunction Act, it's not a tax, it's a penalty. He actually said it was a penalty for purposes of the Anti-Injunction Act. He said we have to read statutes rigorously. But when it comes to the Constitution, we can take some liberties because we want to avoid declaring that an act by the U.S. Congress is unconstitutional. So that's how he got around that.
Okay, thank you, Bob. By the way, the two mics, just so you know, are causing interference, so they work one at a time. And if you can all hear me, I'll ask the questions, and we'll keep the mic with Bob. Is that okay? Okay. Next, Bob. Are the rumors true? Now we're asking about rumors. About the administration wanting to nationalize our 401ks, IRAs and 401ks, transferring funds into T-bonds. Thank you.
Well, this is a bit removed from constitutional law, but the rumors are not true. What has been proposed is a cap on contributions to IRAs, 401ks, and other tax-exempt, tax-deferred entities. And that limit would be triggered by the size of your accounts reaching a certain threshold. I believe the number I've heard is about $3 million. So it does not mean that your existing IRA or 401k is going to be confiscated. It does not mean that those assets cannot continue to accumulate tax-free within the account. What it does mean is once your account reaches that particular size, you may not make any further contributions to that account without violating the law if the law is passed. And of course, this is just conjecture at the moment.
Next, you may have answered part of this, but I think it's worth maybe a restatement. Many of the arguments were made, and Roberts still allowed Obamacare. Continuing to talk about why we should have won seems frustrating and a waste of time. So right now, where do we go to repeal Obamacare from here?
Well, there are these two routes that I mentioned, both of which are unlikely. The legislative route is certainly unlikely and least likely to be effective. The judicial route, with 5 different attacks on Obamacare now pending, it's conceivable that one of those attacks might be successful. But I'd still say an uphill battle.
Good, thank you. Okay, 2 more questions here. This is another one. Assume that 10 million people fail to buy insurance. How many regulators do you think it would take to enforce the mandate? How will the administration ever enforce the penalty clause?
It's a very good question because there are no enforcement mechanisms built into the law. And the only way that the law can be enforced right now is if you're owed a refund by the federal government on your income tax, and you expect to get that refund, they can offset against that refund this penalty, which Chief Justice Roberts has renamed to be a tax, and you will get your refund less the amount that you are docked for not buying health insurance. That's the only enforcement mechanism that exists.
Okay. One more question. Why has modern day legislation, Congress, moved toward all or nothing legislation? What happened to passing or repealing parts of legislation, and is that still possible?
It is possible. We saw an attempt at that today with the Toomey-Manchin compromise on gun background checks. Now, it failed. It was defeated, I think, 54-46, and it required 60 votes to pass because it was an amendment. But it was an attempt to treat just part of the problem, just background checks, just private sales. It was an attempt to treat that and not get into assault weapons ban, caps on high-capacity magazines, etc. And we do this in a lot of different areas. Now, sometimes Congress finds it desirable to lump legislation together, and they do that in a process called log rolling. And log rolling simply means satisfying various constituents within Congress. So you'll get a congressman that says, I'll put this in the bill if you put that in the bill. And the bill gets larded up with all of these Christmas tree provisions because it's a means of satisfying the varying interests of the congressman. That sometimes is intentional, but there are occasions when we separate out parts of the bill and try to pass them separately.
Okay,
thank you all very much.
Thank you, Bob. Thank you very much, Bob. Now, Bob will be around for a few moments, as will Ismail and some of us from the